Well, being the first person after lunch, hopefully y'all aren't going to be needing a nap, little snoozy time. I know sometimes the afternoon can be a little snooze factory. So anyways, wakey, wakey. Thank you for the great lunch. That was actually really good. And so I want to just thank the folks who are in charge of feeding us. Thank you all for this week, these last 2 days. So do I have to bend over, or does this like pick you up if you're standing up? Lift it up? Okay. Can you still hear me? Okay, cool. All right, so I think most people know pretty much that my background, I have a master's degree in counseling, and when I was in school, one of my favorite professors for my marriage and family class, one of the things that he used to say was that families are sacred things. And he would always remind us that when you begin to talk about someone's child, you have to take your shoes off, okay, because you're walking on sacred ground. And so I've never forgotten that. You know, as we begin to talk about the child fatality review team, I want us to sort of mentally take our shoes off, right? And to realize that we're really talking about not numbers, but individuals and loss. This represents loss. And so if there are 1.2 million people in Mecklenburg County, that means there are 1.2 million different stories. Each story is different, just like a fingerprint. Each and every person, one way or another, has a family story. Even if they're adopted or don't know their birth story, that becomes part of their story of origin. One of our jobs is to be the Board of Social Services. So we wear that hat. And we have to make sure that we're doing the best for our children and our families. All of the topics that we're covering are related to one another. We've already kind of established that this is all kind of an ecosystem, right? So all of these things play a part in a child's life and in a family's life. So we all know that in the very best of circumstances, parenthood is not easy. We all know that babies do not come with an instruction manual. I am the mom of 3 adult children, and I can tell you, anybody in here who's a parent knows it's scary as hell to raise a child. So that is why Child Protective Services social workers are highly tuned to observing families, right? And this slide is talking about one of the top problems, one of the top reasons for preventable deaths of children and babies, right? Unsafe sleep is one of the biggest causes of preventable deaths for our infants. And so our social workers are trained to teach people about that. And from the very beginning, or as they become involved somehow with Child Protective Services. So I want you guys to know that, you know, the goal of the Child Fatality Review Team is to eliminate preventable deaths and reduce all child deaths. So I want to give you a sense of who is in the room in these Child Fatality Review Team meetings. CMPD, medic, the coroner's office, CMS, public health, of course, DSS, YFS, there are doctors and nurses. It's a room full of literally amazing people. And each case, each child fatality case is reviewed one by one in as much detail as possible. And collaboration is given around what could be learned, what could be done differently, was something missed, and all of the folks in the room contribute to the conversation. So this is a list of the types of cases that are reviewed, which include, some of them are unintentional injuries, violence, motor vehicle accidents, suicide, deaths related to maltreatment, or child deaths involving a child or a child's family who is reported to or known to Child Protective Services. This side explains that the CFPPT is breaking into two teams. So it's been called the CFPPT for a long time, and now due to some new legislation that became effective on July 1st, it's breaking into two teams. One is the Child Fatality Review, which is led by Cotrain Penn. Did she leave? She gone. And Rosaria Trishalo. And so I wish that they were both here, but raise your hand, Rosaria. Okay, so they're the two chairs of that team. And so that team reviews all the cases, and then that team will then share the recommendations with the Community Action Team, and that is currently being led by Corey Goldstein of Safe Alliance. And it's made up of some partner agencies that are charged with moving the recommendations into action. So I'm going to be attending both of these, the Child Fatality Review and the Community Action Team. All right, so this graph shows the child death rates from 2019 to 2023 that are 0 to 17 in Mecklenburg County versus the whole state of North Carolina. Okay, so our rate is slightly below the state rate, so we're the blue line. Here are the number of deaths broken out by leading causes. You can see that perinatal conditions are the top cause, 31.6%, which perinatal means the time, usually a number of weeks immediately before and after birth. Okay, so that's the top line there. Here are the deaths by age groups. Over 2/3, 69% of deaths occur between ages 1 to 4 and 15 to 17. So among the leading causes of death in the 15 to 17 age group are homicide, suicide, and unintentional injuries. Here's the breakdown by race and ethnicity. Black children make up over half, 57%, of all deaths in 2022, even though they only make up 32% of the total child population. So the biggest focus of the work for the team is around preventable deaths and what the county and its partners can do to reduce these deaths. This slide has a staggering statement right there. 208 child deaths could have been prevented from 2018 to 2022. 208 preventable deaths. Preventable deaths make up 33% of all child deaths in 2022. So here's the map, our famous map, which shows where by zip code the preventable deaths occurred from 2019 to 2023. So the darker the color, the higher the number of deaths. Remember, preventable deaths include intentional, unintentional, and child abuse fatalities. This tragic slide spells out the types of DSS-involved fatalities that were reviewed by year. It is important to note that DSS was involved in that child's life prior to their death, and that not all occurred due to child abuse maltreatment or neglect, but nonetheless, these child were folks interacting with DSS. This shows the children in Mecklenburg County's custody. In HHS committee last week, I believe it was, we heard a really encouraging report. Denise Steele Campbell, are you still here? There she is. She really gave us a great report about the number of children in custody coming down in 2025. She also highlighted the retention rates for social workers, and I found it really, really encouraging. They are really strengthening the team and showing progress that I've just been, wishing for a number of years, and I'm just so pleased that it looks like it's happening. So thank you for that. And that last slide is pretty. When I look at this, my head spins, and so if we have questions around this, Rosie is going to come up here. She's going to stand right here, and she's going to answer the questions. Or Denise, sorry. I always call her Danielle Steele, like the author, Danielle Steele. It's Denise Steele. Anyway, so if we have questions about that, we will have the subject matter experts, because that just really blows my mind. Okay, so this slide shows the many partner agencies and organizations that collaborate in this space. So you'll recognize many of our nonprofit friends here. And so these folks are all doing amazing work. I'm just giving you a minute to kind of look at some of the names there. So this slide is highlighting some of the actions that the CFPPT has taken, including distributing gun locks, safe sleep-related materials, and creation of a child abuse maltreatment prevention strategic plan in partnership with UNCC, and y'all remember that we funded that a few years back. Here's a little bit more about the strategic plan here. The priority areas for prevention include positive parenting, parental mental health, parental substance abuse, domestic violence. And here, this speaks to the triple P, which is the positive parenting, promoting positive parenting, triple P. This is an evidence-based parenting program that helps children by providing interventions for parents who need tips and strategies to prevent child abuse and neglect. So these are programs addressing parental mental health. You'll recognize some of these programs, such as RECAST, which is a grant-funded program that brings evidence-based trauma-informed practices, improving access to high-quality mental health services and support to curb community violence. Parental substance abuse prevention. This is a selection of some of the things. It's not all inclusive of programs that are funded in part by Mecklenburg County opioid settlement funding. Programs for domestic violence prevention. These are programs that work to address domestic violence prevention. And I'll just point out here that Housing for Good is a rapid rehousing program for families fleeing domestic violence. Housing for Good is part of our rental subsidy funding. So this slide highlights some of the ways that a social worker can play a critical role in the promotion of firearm safety. So one of the things I asked Rosie to do was to, let's talk about what a day in the life of one of these social workers might do. And so that's why we wanted to highlight at the beginning, they might teach about safe sleep habits. They might also teach about gun safety. So I just wanted to conclude with a little personal story in that when I was in second grade, my family moved literally across the country from New York to New Mexico to move in with a relative. And mainly it was because my parents didn't feel equipped as parents. And I remember it being strange and uncomfortable and full of tension. But in hindsight, I really respect my parents for doing that. They really felt out of their depth and they sought help. Because as we've established, parenting is hard and it is a long-term thing. It's daily, it's yearly, and sometimes tragedy comes home. But I believe that the trajectory of a life can be radically changed through meaningful, skilled, caring connection. So this is what's behind my deep respect for the people who do the work of counseling, social work, and mental health in general. In Mecklenburg County, parents can seek and receive help. This is why I have really loved serving, and this chokes me up. Serving on this team has just, it's been one of the highlights for me over the past 7 years, even though all I really do is a lot of listening and very little speaking. I truly love being with the social workers, the counselors, and the administrators who are really trying to reach people one by one on a huge scale to save lives and to improve trajectories. And to me, there's just no greater calling. They are literally heroes, and I think we need to keep lifting them up, raising their wages, and valuing what they do for our community. So my subject matter experts, Rosaria and Chantel Lowry, they're from public health, and they are really doing amazing work. And so I wanted to say thank you to them now, and to all of their colleagues that serve in this way. So I'm super proud of the county and how we work in this space. So with that, I don't know how long that was, but.
You're good.
Okay.
Good time.
All right.
So 3 minutes, Madam Clerk. We'll start with Commissioner Griffin. We'll go to Commissioner Powell, then Commissioner Altman.
I'm looking at my notes, Mr. Chairman.
You want me to go?
No, I'm good.
Don't ask me any data questions,
Yeah, I was-
Griffin. Come on now. Give me a break up here. Give me the touchy-feely questions. I'm not good at the data questions.
I think your presentation is absolutely phenomenal. Certainly, this is so critically important because we're talking about children. And clearly, it's all of our responsibility to make sure that all of our babies grow up healthy. And but I was looking at, because I was just curious, it's not really data, just some numbers on your slides. On one slide, you got child deaths 0 to 17, Mecklenburg County versus North Carolina, 2019 to 2023. And it says 59.1 for Mecklenburg County. And then the slide right after that is all child deaths 0 to 17. And you got like 155, and I was just kind of curious in terms of the numbers. But I thought the last slide, not the last slide, but a slide that has the number of DSS involved fatalities, no matter which one of those numbers you look at, whether it's a 155 or 59, there were only 9 DSS involved families. So obviously, where prevention and intervention is going on, it appears to be working, whatever number it is, whether it's 59 deaths or 155 deaths. And that is a good thing in terms of data. But I was just wondering which one of those numbers was, what's the difference in the interpretation of those numbers? One is 59 and one is 155, but.
Something that trips me up sometimes on these is the death rate versus the actual numbers. I don't know if that's it, because right now my brain's like flipping around in circles and I don't really know.
But the numbers say to me.
But Rosie might know.
That's it.
Yeah.
That is it. The 59.1 is the rate.
Oh,
Is the rate?
Yep. And
Oh, okay.
155
Okay.
is the number.
see, I knew that. Okay.
And the
It's the rate.
155 is the actual number. Still, that is significant because, it just really, the difference is really significant. And I think a lot of that goes to what we're trying to do in terms of prevention. Last question before my 3 minutes is up. There is a group that recommends or identifies gaps and deficiencies somewhere on these charts. Yeah, it says identify systems gaps and deficiencies. Can somebody speak to that a little bit in terms of what are the gaps and deficiencies in that process by the child fatality review team?
Rosie's going to answer that.
Rosie?
Commissioner, is this on? Can everyone hear me all right?
Yep.
So when we refer to identifying gaps and deficiencies, part of the review process when we meet as a team involves discussing, with respect to the events of the death, were there certain protocols, processes within our different partnering agencies that were present or involved with the death that could have been improved upon? For example, with medic, a lot we talk about response times and different protocols. If it is a death related to a child suicide, were there processes that could have been improved with our partners at CMS to have helped identify some of the challenges that child was going through and connect them to resources. So that's what we mean by identifying gaps and kind of improving systems in that way.
Yeah, I mean, I think that my time's up, but I think that's important, Mr. Manager, as we look at the balanced scorecard, in particular relates to SMART goals in terms of who's the customer, and then what were our expectations in terms of that intervention. So thank you, Mr. Chairman.
Thank you.
And before we go to the next person, I just want to say that, you know, when we talk about that, like what Rosie just described, I want you guys to know that the room that this takes place in is you know, like I said earlier, it feels to me such a respectful place where these things are not talked about in any kind of light way. They're talked about in very serious and somber terms, and everybody is extremely respectful.
Commissioner Powell.
Thank you. It is emotional because we're talking about children. I have you know, like you were listing, and I don't even know what slide number it was, why social services would get involved. And one of them was, I think it said car injury, vehicle injury. And so I think it's probably better for one of your subject matter experts to answer, like, in all these different instances, how are they notified? You know, like if a child has a head injury, are they notified by medic, hospital? You know, how are they notified for different kinds of injuries?
I don't think that was a DSS necessarily involvement, if it was just a vehicle, motor vehicle accident, but it could be that someone who was involved with DSS happened to be in a motor vehicle accident, but you wouldn't call DSS because of a motor vehicle accident. Is that right?
Correct.
Okay. Does that make sense?
It does. And so if you could just tell me, how are you notified? Like, you know, if somebody's like, does medic call you sometimes? Is it the hospital? Who calls you guys to say, look at this injured child?
So what would happen is we wouldn't get a call for any and all motor vehicle accidents that involve children. What could happen is if a child is in the hospital and the parents aren't meeting the children's needs, then we would be contacted by the hospital to say that we have this child that is in need of medical attention. The parents are not following through with that, and therefore we need DSS intervention to ensure that this child's needs are being met. That would classify under medical neglect for us.
Okay, thanks.
So, Commissioner Powell, are you asking, like, if it seems like the child was in an unsafe, they were in an accident, but it was obvious maybe they weren't seat belted or in their car seat or something like that, and would they notify DSS in that kind of case?
Yeah, like I heard somebody reversed over their child with their car, and DSS was involved, and I thought, well, who notified them? Was it the police? Was it medic? You know, like I just was trying to understand how it's done.
And it could very well be either of those, depending on the situations. We get calls from police, from the hospital. Those are some of our highest reporter sources.
Well, thank you for shining the light on this, because it is such important work. And in a world that's so disconnected, everybody wants to be on their computer and remote, like these human touch points matter. So thank you.
Commissioner Altman, then Commissioner Leek, and then Commissioner Dunlap.
Commissioner Rodriguez-McDowell, I really appreciate your amazing presentation. I think you did a phenomenal job. I think in the 7 years or 6 years that I've been here, I don't know that we've gotten this level of detail and insight, and it was, you could hear a pin drop in here. I appeared before the Child Fatality Task Force once as an attorney at the Council for Children's Rights. And when she says it's respectful and somber, that is the understatement of the year. It is, a space where the most horrible tragedies to the smallest amongst us, one after another. It's really absolutely heartbreaking. So I join you in lifting up the people who come and do that work, and I thank you for your service there.
Thank you.
Commissioner Leek.
Thank you, sir. The most valuable people we have are children, our infants who become adults. And in between that birth and death, all things take place. And it bothers me when I know that and come in contact with young children who've been abused, who've been neglected. There's more than one way to neglect a child. It's not by just walking away. We neglect our children by not even communicating with them or having an opportunity. And my experience with, Sunday school, Bible school, all of these things play a role in developing our children. And we neglect the very people that will be our future, who will, I always say, give us a cool glass of water. We can't get it ourselves. And I'm sorry we have to have in this report about fatalities that today we are seeing more children being killed than we've ever seen in the home, shooting, violence, all domestic violence, sexual harassment of children, taking advantage of them. And you see a lot of teachers, a lot of preachers, a lot of dignity-carrying people within the confines of our community take advantage of the weakest of weak, and that's our babies. And I listen to the young people who come to us to talk about domestic violence. There's more than one way. Bullying is a form of domestic violence, even if the child is not, the wife is, or the maid is. And I want to thank you for this being, I guess, our last report that lends toward the ear of the most valuable possessions that we can have is the birth of a child. When many people want children and cannot. And it's a role that we play as a community, not to introduce them to those things that they should not have. And many of us are weak, and we do it. Alcohol, drugs, prostitution of young children. I never will forget a social worker came to my sociology class and spoke about a father had taken advantage of a 4-month-old baby girl who had to have 4 or 5 surgeries to recorrect what the father had imposed upon this child. So there's a lot going on in our community, and we need to be more aware of it and be careful about who we put our children with. I say to people, be careful who you allow to deal with your babies and your children. It's a danger. So thank you. Was that my bill to stop?
Yes, ma'am. Thank you.
STOP mean what? What does that mean?
Stop.
Thank you.
Commissioner Dunlap.
Thank you, Mr. Chair. First of all, that was a very good presentation on what's going on, and I'm sort of like my colleague here. It's the first time it kind of really out there so that you would understand it. I would like to know more about what's happening to that 399 kids who are in custody. I'd also like a breakdown of the 56% of African-American children deaths. I'd be curious to know how many of those were by a gun. The recommendations, again, because I think the focus ought to be on preventing those 200 and some deaths that occur. And then lastly, whatever Mecklenburg County is doing, you should be commended, because this is one of the first time I've looked at a chart that says that Mecklenburg County is below what the state is doing on anything. And so you guys ought to be commended for that, really.
How many of them are here?
So if you want to start with this chart, the 399 children, we'll have Denise and Rosie talk to that.
So currently, we have, as the slide shares, 399 children who are in the custody of the department. Our goal for our children who are in custody is for them to seek permanence. We always try and work with families to reunify our children with the biological parent if that is in their best interest. We also do a really good job in identifying if the parents are unable to meet the needs of their children and to ensure their safety, then we will identify kin. If we cannot place with the biological parents, we want our children to be placed with their kin. So this represents a total number of children who are involved with us through various maltreatment issues. It could be abuse, neglect, or dependency. So again, our goal is to reunify our children as quickly as possible with a family member, with a custodian or a guardian or a permanent plan of adoption. I do want to share, just have to highlight the work that we've done over the last few years. The number of kids that we have in custody now is the lowest that we've had in years. We've had as many as 1,000 kids in our custody, and we are now at 399. And that's just a result of the work that the social workers are doing to ensure that our children and families are safe and getting the resources they need to be successful.
Thank you. That breakdown of that 56% of deaths.
Thank you for your question, Commissioner.
Yeah, right there.
So while I can't speak to an exact breakdown of that 56.6% today, I will provide sort of a teaser for this time next year in that part of the legislation that was just passed, effective as of July 1, means that as part of our new process around child fatality review, our team will be presenting to the board with sort of our new process and our data each year. So come next year in our report, we'll be able to do further analytic breakdowns of our data, sort of breaking this down even further by category of death. So for example, violent deaths, as well as suicides, drownings, motor vehicle crashes. So we'll have sort of a closer look at some of that for you. I want to speak to and just highlight again some of the wonderful programs that we have that are working on all of these deaths, whether that be our Office of Violence Prevention that is working on, again, targeting some of those violent deaths and reducing community violence. We have our Prenatal to 5 program and all of our sort of case management programs that target those perinatal conditions and deaths related to our #1 cause of death in that way, as well as a lot of our injury prevention work that we do with a number of the partners that Commissioner Rodriguez-McDowell highlighted that are part of that community action team work. So again, happy to provide additional breakdown as this group continues to work.
Thank you. Commissioner Meyer.
Oh, thank you. Thank you for your presentation, and I'll start with touchy-feely stuff. Just thank you for sharing the experience you're having with the commission you're serving on, because we don't all hear about what we're serving on, and this was really interesting, and the numbers are absolutely sobering. Something that I also haven't seen, so thank you. But I do have a question about that one Child Protective Services chart. I don't know the number. It doesn't
Okay.
have.
What was on the chart?
It's the one, children in custody by age, Child Protective
Oh,
Services
okay.
needed. The Child Protective Services needed at 770, is that foster care? And then they come back. Tell me, how does that relate to the 399?
So with every case that we're involved in through investigations, a case decision is made at the end of the investigation. And what you have here is a breakdown of the case decisions. So when we have a case that has the Child Protective Services needed, what that means is that we have investigated a family and we have found that we are not closing our case because they're in need of additional services. We have not removed the child from the home. It doesn't rise to the level where the child is unsafe, but we have found that the family is in need of additional services. It could be parenting classes, it could be domestic violence services, but it's enough where we are continuing to work with the family to ensure that they are participating in services while at the same time ensuring the safety of their child. So not in custody, still in the home with the parent.
Okay, all right, thank you, I appreciate that. And I also just want to highlight that I really there's a lot of focus on parental well-being and how important that is.
Yeah.
Because, when people are desperate, they do desperate things and things that, they don't mean, and it's just so important to help the well-being of our parents who, again, our kids don't come with manuals, so, but thank you, I appreciate it.
Yeah, if parents aren't okay, then kids are
kids are not okay.
definitely not okay. So, well, I think with that, right. Sorry, Mr. Chairman.
No, you're fine.
I'm not forgetting you.
No, you're fine. I just wanted to say a couple of things. One, thank you for the presentation. It was really enlightening. I echo the sentiments that everyone has raised. A couple of things I do want to lift up, and one of my biggest takeaways is going to be the number 208 from this presentation. That was the preventable deaths.
Mm-hmm.
And when I think about that, think about the loss in terms of human resource, human capital and resource in that way. So what did the community lose? What did the country lose? What did the world lose as it relates to preventable deaths?
Yeah.
And so that sort of hit me like a ton of bricks. The second thing is, sometimes in staff, I want our staff to really understand when we shout you guys out and when we're lifting you guys up in ways, these are ways that the board can do it when we're calling out, and it's not performative. It's something that this board recognizes as we travel, as we get to talk to our colleagues that are from other places. And when I look at Child Protective Services or our program managers or our caseworkers, people that are like leaning in the community every day and helping people and meeting people sometimes at their worst, under the worst circumstances that we could ever imagine. And that also hit me from the presentation, not directly, but indirectly, because I'm constantly concerned about the work that we do in this human services space and how our staff and our team is adjusting to the mental health components that Commissioner Meyer raised earlier, right? And so what do we do to provide resources for our own that have to deal with this every day? Like we get to go to it monthly or hear about it in committee, but we're not doing it every day. What's the toll on their families when you have to take that home with you? And so I only lift those things up to say, on behalf of the board, thank you to all of our staff, all of our team, no matter where you are, to know that we are thinking about you. We appreciate, and this community appreciates that level of commitment, because as we saw when we went through the income breakdowns, you can't really put a price tag on what you do. So I did not want this moment to pass without lifting that up in that particular way, and thank you, Commissioner.
Yes, thank you. It's one thing that I think I heard over and over again was surprise. And, you know, I think maybe we should be looking for ways to share out from our committees or where we liaison or something like that to each other.
That's a good point. I got a mental note when she said that, because you're right. We don't hear from our committees. And I've heard Commissioner Leek say that over the years as well. So thank you.
All right. Thank you, everyone.